Hey guys, it's Amy and Mandy, the little pillow princess over there. And I just wanted to give you guys an update from the last video I did. So I was pretty bad off in the last video, and I owe you guys an update. So, basically, my rheumatologist went back and forth between different medications to, or we talked about different medications. We didn't try any until we decided on one. And we decided on Remicade infusions. And I started them on June 27th. And haven't been completely pleased with it yet, but I think it just takes a little bit to get built up in your system, and I want to give it a fair shot. I mean, Actemra took a good 7-8 months for me to feel like, okay, I guess this is working. I guess this is a good medication for me. So hopefully Remicade won't take that long, because so I forget the word they used. They like time the infusions differently than they did the Actemra, because the Actemra was like every 4 months. Or 4 months, what am I saying? 4 weeks, so every month. And it was like an hour-long infusion. Remicade, they had to time it. They have to time it differently. I feel like they used the word titrate or something like that. Something that I hadn't really heard before. So I started on June 27th, and that infusion lasted 2.5 hours. Then the next infusion I had was 2 weeks later, on July 11th, and that one lasted like 2 hours and 15 minutes. My next one is 4 weeks after that one, and it'll be on August 8th, and it should be about 2 hours. And then I think I do another 4 weeks, and then I go 6 weeks, and then 8 weeks. I don't know. We have to decide if 6 weeks or 8 weeks is going to work. I have no idea. This is like so confusing. So anyway, as I was saying, I haven't noticed a huge difference with the Remicade yet. Right now I'm just on Celebrex for my osteoarthritis and Remicade for my rheumatoid arthritis, and that's it. Which is kind of nice for a change, because before I was on like Celebrex and Plaquenil and Areva and the infusions and all that, so it's kind of nice cutting back on all those medications a little bit. But I've been keeping a good like diary of my experiences, so I can have a good idea of, you know, in a couple of months if this medication is really working for me, or if I don't know what other options I have right now, but maybe there's another option down the road once my liver enzymes go down enough. I might could try Xeljanz. We were going to try that, but my blood work wasn't good enough. I didn't pass my blood work. Anyway, so before, I'm just going to like, I guess, go over my like journal type thing of what the Remicade's done so far, and then I'll update you guys again in a couple of weeks. I see my rheumatologist on August 12th, I think. So hopefully I'll have a good idea by then. Crossing my fingers. Okay, so June 27th was my first infusion of Remicade. And before the infusion, my joints were very swollen, hot, they felt like they had sand in them almost, especially my hips and shoulders and knees. Those were like the biggest sandy joints. Morning stiffness was lasting well into the day, usually 2-3 hours, and I was extremely fatigued. I rated my overall pain scale on an 8 to 9 out of 10, which is significant to me because I have a high tolerance of pain, and especially these stupid pain scales, I hate them because I'm just like, how do I put what I'm feeling into a number? But anyway, during the infusion, no significant changes, but I was very nervous about this infusion because I did have that adverse reaction once to the Actimra, and so I was just really nervous about having another adverse reaction. And so after, like immediately after the infusion, I felt the same as before, but I felt restless and very washed out, and I had nausea, a lot of nausea. My max effect, meaning like when I felt it was actually doing I was doing the best I could possibly be doing, you know. My morning stiffness was reduced. It was significantly reduced. It was not lasting 2 or 3 hours. It was lasting 1 or 2 hours. So that's a good improvement. My pain ranged all the way from like a 3 out of 10 to a 9 out of 10. But I thought at that point my pain was better, easier to be managed. Overall, I had a positive attitude about it, but I was having a lot of trouble sleeping, which was weird. My joint swelling and warmth and redness and stuff like that was reduced, and I felt like this about a little over a week after my infusion. However, during that time I wasn't able to truly test my abilities, you know, because I'd come down with this horrible cold. Like, my mom got it, and then my dad got it, and then I got it, and it was the worst cold or virus or whatever I've ever had in my life. It was horrible. So I was very limited. I was like bedridden. Okay, so July 11th I had my next infusion. Before this infusion, stiffness in my joints, swelling, and sandy feeling in those joints again was present but manageable. Greatly fatigued, pain, 7 out of 10. During the infusion, it was a little different this time because I felt extremely fatigued and lightheaded. And I was kind of feeling uncomfortable in my stomach, like, not nausea, just a very uncomfortable feeling. But it went away, so I didn't really tell anyone about it. Go me. So after the infusion, I got a migraine. And the whole sensitivity to light and sound and nausea and everything, I fell asleep when I got home. My joint and muscle pain was a 7 to 8 out of 10, but it was also bad weather, so that could have affected it as well. And I felt really agitated, which I kind of figured was pain related. And the migraine, of course, didn't make any of my body feel better. You know, I was already nauseous, and it just, you know. Joint stiffness and morning stiffness greatly reduced. Max effect was reached. So, yeah. When was it reached? I don't know. I didn't write that one down. Great job. But I'm pretty sure I wrote this up a week or so ago. Probably about 10 days after the infusion. So, yeah, about a week ago. Joint pain wasn't great. It was still an average of 7 out of 10 most of the time, but I didn't have any significant hot or swollen joints except my right knee, right foot, and right ankle. Don't know why. And my nausea still is like coming and going, and I have this really weird sensation on like the tops of my thigh muscles, and I think it has to do with just my hips and bursitis and everything, but it's very uncomfortable. It's like to the point where I don't want anything touching my legs, not even like clothing. It's extremely painful. I don't know what's going on, but anyway, I don't think that's rheumatoid arthritis related. But the fatigue had been better and more manageable. So I've had 2 infusions thus far, and I have my next infusion next week. And hopefully when I'm done with like this process of going 2 weeks and then 4 weeks and then 6 weeks and then 8 weeks, I'll have a good idea of like what this medication is doing, because right now I feel pretty lousy. My feet are so incredibly hot and swollen and painful, all my toe joints and stuff like that, and I know my weight's not helping that, but it's that catch-22 where you're like, I need to lose weight to help this, but I can't because it's hurting so bad. So I definitely need to get in with my pain management doctor or something and figure out something, because I can't take my feet. This is crazy. So that is my update, and I will say that morning stiffness is still decreased. It's not 2 or 3 hours, which is huge to me. So I'm able to get up out of bed and get moving a lot quicker in the mornings, which means I don't have to wake up as early. And my sleep is so valuable. So yeah. Okay, I'm gonna stop rambling. I will update you guys in a few weeks, and I hope you're doing well.